kit has to be taken when you have a heart attack, not when you have a chest pain. 90% of these chest pains, they're not heart related.
How about a glass of red wine a day? Is it cardioprotective? I'm asking for a friend. So as a cardiologist, Dr. Bharat, what is that one thing that you would never do?
So the best treatment of a heart attack is avoid it.
Hello and welcome to Yashoda Health Talk session where all your health related queries are answered here. Well, today we'll be tackling an important topic which is affecting millions of us, that is heart attack. But don't stress out because we'll be discussing about some incredible treatment advancements which are happening in heart attack and changing the game. Welcome to the program, Dr. Bharat, and it's always good to have you.
Yeah, thank you, Lakshmi. How are you?
I'm good. I'm great, in fact.
I think it's always it's good to have these kind of conversations, which not only helps me refresh my memories, and it also helps our audience to gain a lot of confidence about what they are doing in their life.
And the information from the right people.
Of course, thank you.
So, as a cardiologist, you're always on the front lines, saving hundreds of lives every day, every hour. What made you choose this path, or what inspired you to become a cardiologist?
See, it is not that many things we choose. There's something called destiny also. And certain events happen in our life which decides our destiny. In my case, my uncle, my father's eldest brother, when I was a very small kid, he had a heart problem. And he went to a hospital and he underwent a surgery. But unfortunately, he could not make. But that remained in the back of my mind. I should also become a cardiologist, and I hope the experience which I had, I will be able to give a better experience to some of my patients, and they don't have the same experience which I had in my life.
So, Dr. Bharat, we are here to discuss about heart attack.
Oh.
So, when we say heart attack, do you think that most of us understand this terminology? I mean, does it look like dramatic as they show it in the movies? Like, they just hold on to their chest and collapse. I mean, is that heart attack?
Yes, of course. The terminology itself is self-explanatory. It's an attack. Like suddenly you are sitting somewhere and you meet with an accident. It's something like that. And it could be life-threatening. And we see that almost 25% of people who have heart attack, they don't even reach hospital. It's such a dangerous thing. So the best treatment of a heart attack is avoid it. The reason why it is so sudden is people may be having blockages. We have heard about angiographies being done with people who have chest pain, angina, and we find that they have 2 blockages, 3 blockages, 1 blockage, or they have minor blockage and moderate blockage and all these things.
By blockage, you mean that it's like
cholesterol deposit.
The water pipe getting blocked or something
Yes.
similar to it?
So, a lot of people nowadays, they are going for CT angio as a part of their routine health checkup to check whether they are also having those blockages in their heart or not. So, having a blockage is not same as having a heart attack. The protective surface on the blockages, which we call as endothelial lining, that protective surface develops a crack. And the moment the crack happens or the plaque ruptures, the underlying cholesterol material gets in contact with the flowing blood. And immediately, when the blood comes in contact with this, immediately the clotting cascade happens and the blood clots. And the flow of blood stops because the solid blood cannot traverse through this narrowing. And that part of the heart where this narrowing has happened, it suddenly is devoid of any blood supply. And we know blood carries all the oxygen and nutrition. So that is where that part of the tissue becomes dead.
So you've mentioned about the different options about heart attack, saying stenting and some clot busting drugs. So what exactly is the difference between these treatments, and how do you decide who gets what?
How quickly we are able to do it will decide how quickly the patient is going to recover. The earlier, the better. The 3 hours is the golden period. 1 hour is considered the best. If suppose somebody has gone to a hospital where there is no facility for any angioplasty or stenting, and ECG and 2D echo showing that he has a heart attack, that means the blood has clotted. We immediately give medication to dissolve this clot, which is called a thrombolytic. It is a clot dissolving medicine. Along with that, we also give some clot preventing medicine. The best treatment is take the patient to the Cath Lab, do an angiography immediately, as early as possible without wasting even a minute. And you will find that this is the area where the blood has clotted. Immediately pass a wire, expand the balloon will break all these clots into small pieces, and they'll get dissolved. And you are 100% sure that you have been able to restore the blood supply.
And also there is another surgery which is called the bypass surgery. And that sounds like rerouting the traffic. I mean, how does it work for the heart?
Bypass option comes in a stable situation. You have tackled the heart attack. Patient might be having multiple blockages. Only one blockage or two blockages might have developed the blood clotting. But what about the other blockages? Now, if those blockages are complex, once the patient is stabilized, maybe after a week or 2 or 3 weeks time, then we can bring the patient back and discuss with him the options, whether he has to go for a bypass surgery or he has to go for an angioplasty for these blockages or not.
So today, most of us are very much conscious and aware about the heart health. So what are some myths that you would like to clear for us? I mean, first one I would like to ask you is about the omega-3 fatty acids. I see most of them just popping it up.
It has been projected as a wonder drug. And what we are seeing is that there's a lot of propaganda going on in the social media and in other medias also. And there's a lot of myth that they are cardioprotectic. Of course, they are cardioprotectic, but in the right dose. The over-the-counter omega-3 fatty acids which are available, the dose which is there, the amount of omega-3 which is there in them is very, very less, and it does nothing. If you are taking a prescription omega-3 fatty acids, prescription omega-3 fatty acids is a very, very purified form of omega-3 fatty acid which we call as a icosapent ethyl. That is the only one which have been found to be cardioprotective. Another myth which is there is you need to have carry with you the heart attack protection kit, which is going on in a lot of social media, that there is an aspirin, there is 4 tablets of clopidogrel and 1 atorvastatin and all these drugs. You need to keep it as a kit with you so that whenever you have a heart attack, you take all these things. Now, question comes is, the kit has to be taken when you have a heart attack, not when you have a chest pain. Be very clear.
Yeah.
90% of these chest pains, they are not heart related.
Yeah.
So
it's more dangerous.
So you are creating more harm than benefit. The best thing is go to the nearest place and get yourself diagnosed.
How about a glass of red wine a day? Is it cardioprotective? I mean, asking for a friend.
This is a part of a terminology, we call it as a French paradox. It was seen that French people, they take a lot of red wine. And it was found that they have less of a heart-related issue. And this whole thing got exaggerated by that concept only, but it is again a myth.
So Dr. Bharat, now with advanced technology and AI in every field, how has that changed the way we practice cardiology? I mean, are we smarter cardiologists today?
See, AI is coming up in a big way in all aspects of our life. It can clearly stratify whether you are at a risk of getting a future heart-related issues or not. Second thing which really I feel is going to be of help is in remote areas where the cardiac facilities are not there. AI will be able to pick up all these ECG changes or the 2D echo analysis and all this thing and tell us whether this gentleman is truly suffering from a heart-related issue for which he need to come to a bigger center and get himself evaluated and checked and all these things.
But honestly, as a cardiologist, do you take up all these preventive measures and get yourself regularly checked up?
Oh, of course, yes. To be very honest with you, I have a very strong family history of heart-related issues, and to get myself checked, I've already got my CT angiography done. So I strongly believe that we all should get ourselves stratified for the heart-related complications, whether we are prone to get it or not.
Somehow I believe that as doctors, we are very bad at taking care of our own health and we neglect it for some reason or the other. So good that you do it.
The most important thing which you are trying to tell me is, when we think of neglecting health means we are not particular in our food habits, we are not particular in terms of our exercises and lifestyle changes in terms of addressing the stress which is happening in our lifestyle, in our life. So these are the 3 important things which I have seen most of the doctors, they neglect, and then they don't give enough time for relaxation techniques like playing, like listening to the music or pursuing some of their hobbies, all these things they forget, and they don't do exercise at all. So I'll suggest all my professional colleagues at least to think about it and make sure that they make a positive change in their life.
So, as a cardiologist, Dr. Bharat, what is that one thing that you would never do?
Please, please, please don't smoke, because that is one habit which has got no benefit at all. And people who smoke, almost 50% of them, they die because of smoking related complication.
And by smoking, I'm sure you mean the various types of smoke, such as cigarette, e-cigarette,
All
vaping.
types of smoking. Even passive smokers are also equally at risk.
So, I mean, now with a lot of AI and gadgets also coming up, so if you were to invite a gadget, be it for saving a heart, what type of gadget would it be and what would it do?
I think the best gadget which we have right now is the smartwatches. They will definitely track your sleep level. They will tell you whether you are getting good sleep or not. They will track your step counts. They will tell you about how much calorie you are burning or not. And in some of them, the health apps which are also already entered, they can also tell you what kind of food you are eating and all these things that you can track what kind of food you are taking. And some of these smartwatches, they have a facility for recording the ECGs also. So if you ask me one gadget, I think smartwatch is the one which we all should be having it with all the healthy apps installed in them.
So many of us who are watching the show, and if they decide, okay, fine, I'm going to take charge of my heart from today. So what is the easiest change that they can make?
The easiest thing which I will tell them is, we must consider that God has given us a life, and we are responsible for not only for ourselves, but we are also responsible for the people who care for us also, which includes their families, friends and patients also. So if we want to make all of them happy, we must make sure that we make positive change in ourselves in terms of stress control, regular exercises, healthy eating activity. If we take care of these three important things, I think that is enough.
So thank you, Dr. Bharat. It was wonderful interacting with you on our program today.
Thanks, Lakshmi. I think it is always a pleasure talking to you, because you come up with all these simple things which make really big change in people's life. I think will really be of help to the audience in general, and they make a positive change in their life. Thank you.
Thank you. Thank you so much. So this brings us to the end of this episode. Hope this episode was informative on the topic heart attack and the latest innovation, technology, and how it is treated. And don't forget to join us next week as well. Until then, take care and stay healthy. Thank you.